The What's Eating You podcast is a series of mental health topics that are designed to make you think, learn, educate, and validate. Enjoy the show. Welcome to another episode on Freestyle Friday. I'm your host and psychologist, Stephanie Giorgio, and I am looking forward to speaking to you today. So get comfortable, relax, and let's head into the weekend on a positive note. For those who don't know me, my name is Steph, and I'm a psychologist here to break it down. What is happening? How has your week been? My week's been pretty good, actually. It's been quiet, which has allowed me to focus on other projects I'm working on. I'm so excited for Food Freedom, which is going to be running in under a month now. If you don't know what Food Freedom is, it is a 12-week transformation that basically focuses on improving your relationship with food. And it is specifically for people with or without ADHD. So I have made it ADHD friendly, which means short, sharp modules. It means addressing ADHD concerns such as impulsivity, such as hyperactivity, because a lot of this ties into binge eating and binge eating behavior. If you are interested in this, please download my free binge tracker and schedule a session with me to talk about whether it is the right fit. It is a free one-to-one because it is an application process. I want to make sure that the people who do apply, they are suitable for the program because I want it to be effective for you. So yes, if that is of interest to you, if you want to improve your relationship with food, stop binge eating, stop worrying, improve your thoughts, your feelings, your behavior, this is like nothing else. So I'm really excited to speak to those who are keen. All right, let's get into today's episode. I'm going to talk about medication and weight gain. So I put a question box on my Instagram asking, what do you want me to talk about? And surprisingly, I got a message saying, can you talk about medication and weight gain? And then very interestingly, on a TikTok live on the same day, I got asked the same question. So I said, you know what? The universe is telling me to speak about this. So let's talk about it. Now, I asked the question, if you knew there was a medication that could improve your mental health, say you had depression, say you had anxiety, say you had mood swings, but it made you gain weight, but it improved your symptoms, would you take it? Have a think about that for a moment. Now, I want to highlight some medications can cause people to put on weight. This can be a good thing if you are underweight to start with. And I want to preface that weight gain is not a bad thing. Everyone thinks weight gain is so bad, it's the worst thing in the world. But for many people, it's actually a good thing. Your body is designed to store weight and store fat in case we go into a blizzard or some sort of life-threatening natural disaster. Your body was never designed to lose weight. Your body is designed to do the opposite. And this is why your biology fights so hard anytime you go on a diet or you try to restrict. You are not a failure. Your biology is not designed to lose weight. It's designed to store fat, to look after you in a disaster. The body is a wonderful thing. So I want to preface that in this episode, weight gain is not a bad thing. However, this will vary for different people, right? So as mentioned, some people might need to gain weight. If you're at an average weight or a weight that's appropriate for your height, then gaining a couple of kilos or pounds may not be a big deal. But if you are already overweight or you have weight-related problems, because health can exist at all sizes, weight gain might be more of a problem. Weight gain depends on a number of factors, right? And I want to make sure I also preface that weight gain does not equivocate to fat gain. People think just because they step on the scale and the scale number has gone up, they've put on all this magic fat. But you won't actually know if your weight change is fat gain. If you're eating properly, if you're doing weights, if you're nourishing yourself, it could actually be muscle. It could even be water. It could be fluid retention. Unless you do an index of body scan or some sort of internal measurement, you actually don't know that weight change on the scale is fat gain. So keep that in mind. Now, when we think of specific medication, it depends on a number of factors: your age, your sleep patterns, and other medical conditions you have. Now, you may only gain a couple of kilos over a year, but some people may gain more weight, such as a few kilos every couple of months. If you need to take the medicine for months or years, then you might gain a lot of weight over time. Medicine-related weight gain, it's not uncommon, especially with certain types of medicines. And I want to make sure you're aware that it's not the same for everyone. So just because steroids can cause weight gain, it doesn't mean that steroids are going to cause weight gain in the same way for everyone. And the same goes for medicines that treat mental health conditions such as depression or schizophrenia. Men and women of all ages can be susceptible to medicine-related weight gain. So what causes medicine-related weight gain? There can be many causes. Some medications actually stimulate your appetite. So this causes you to eat more than you normally would. And obviously we know a strong theory is calories in, calories out. So if you are eating more, that can change your body composition. Similarly, some medicines may affect your body's metabolism. So your metabolism is essentially how your body burns calories. And if your body's metabolism is being changed by medication, it can cause your body to burn calories at a slower rate. Other medications cause you to retain water. So you may look more puffy or more bloated or more inflamed. And this is not your fault. It is the medication. So if you're retaining water, this means you weigh more even if you don't put on extra quote unquote fat. Other medicines might affect how your body stores and absorbs sugar and other nutrients. Another reason that medication can cause weight gain is it can cause you to be tired or have shortness of breath. And when you're tired and feel short of breath already, this means you might be less likely to exercise because you feel tired. And again, lack of exercise, lack of moving your body can also cause weight gain. And for other medicines, researchers aren't exactly sure what triggers it. So I don't want to freak anyone out, but here are some medicines that may cause weight gain. And again, this is generic. It may not suit everyone, but I imagine this may be very validating for people whose weight has changed and they're on one of these medications, because a lot of shame, a lot of doubt, a lot of embarrassment, I imagine, can come from certain people who gain weight being on medication. They think, gosh, I'm on this medication to try help my depression or anxiety, and now I've put on weight. Can I get any more, unwell? What's going on? And I am not saying that weight gain is a bad thing, but in society, there is a stigma around it. Okay, so medications for diabetes, such as insulin, thiazolidinediones, and I'm not even going to try and say this. Okay, I will. Sulfonylureas can cause weight gain. Obviously, insulin, diabetes, really tricky to manage that, especially type 1. Antipsychotic medications. So we know clozapine, risperidone, olanzapine, quetiapine, and lithium and haloperidol, that can cause weight gain. Antidepressants such as imipramine, paroxetine, escitalopram, citalopram, mirtazapine, and sertraline. Again, this may not affect everyone. I know many people on sertraline and their weight has stayed quite stable. So it really comes down to your lifestyle as well. Epilepsy medications such as valproate, Devalproex, carbamazepine, and gabapentin. Steroid hormone medications such as the birth control pill, right? Because hormones can control whether or not your weight is being managed. And there's also blood pressure reducing medicines such as beta blockers, such as propranolol and metoprolol. That was a tongue twister. So it's important to note, not all medications cause weight gain. So some may actually make you lose weight. Keep this in mind. Now, remember, it's not the actual medication in many cases that is causing the weight gain solely. It's the side effects from it, such as tiredness, shortness of breath, increased appetite, that may lead to the weight gain. So if you can manage the side effects and if you can recognize it, then you'll be in a much better place. So now that I've spoken about this, I will talk about some strategies to manage it. First of all, your weight gain may not be bad, so you don't need to freak out about it unless you need to freak out about it. Many people are obsessed with losing weight when they have no medical reason to lose weight. So if you're freaking out about weight gain, you need to ask yourself, am I actually medically required to lose weight? Or is it diet culture in my head that is telling me I should weigh a certain size? Because health can exist at all shapes and sizes. Now, how is medicine-related weight gain treated? It will depend on your situation. Sometimes your healthcare provider might recommend switching to another medication, but again, this takes an adjustment period. So you really need to ask yourself, is the juice worth the squeeze? And I imagine your healthcare provider is probably not going to switch your medication unless you've gained a significant amount of weight and your health is adversely affected. In many cases, it may not actually be possible to stop the medicine that is causing your weight gain, and another medicine may not be available. So if you're concerned that a medicine is causing you to gain weight, take a step back and think, okay, what is it? Is it the side effects? Is it making me more hungry? Is it making me tired and I'm not exercising? Am I not getting as much steps in? Am I not drinking enough water? Am I holding a lot of fluid or retaining a lot of water? Do I feel more puffy than usual? Am I craving foods that leave me a bit more bloated and inflamed? So if you get those things better managed, then it could be another reason. It could be the hormones. It could be the metabolism. So what we want to do is, first of all, take a step back and identify what is it about the meds that is influencing my weight and can I control it? So the first thing to do, as I said, is take a step back and don't panic. Whilst weight gain can be really uncomfortable for people, it is not the end of the world, even though it feels like it. It's positive you're aware of this, and awareness precedes change. Secondly, ask yourself, what is so bad with a bit of weight gain? What is that going to do to my life? Am I not going to get a job? Am I not going to do well at my job? Am I not going to get a partner? Like, what is the insecurity? What is the beliefs about weight gain? I've gone through many stages with my body, and in a year I did put on 10 kilos, and this was a significant change, but I realized, why is that so bad? I just think it's bad because I've been programmed to think I should weigh a certain weight. So if this is you, reflect on, do you actually need to be worried about this? Or is it your brain making you think you need to be worried? Number 2, be kind to yourself. You are battling a mental illness after all, or some sort of illness. So you don't need to hate on yourself now for something outside of your control. It's not your fault that medications have side effects. 3, is this something you're willing or wanting to address? As I mentioned, just because you've gained weight or your weight has changed, can you accept this without it compromising your mental and physical health further? For some people, weight change isn't an issue, and for others, it can be debilitating. So on a scale of 0 to 10, 10 being the worst distress you can absolutely imagine, and 0 being no distress, how distressing does this feel to you right now? And if you're willing to address it, are you willing to put in the necessary steps? It's not so simple as changing medication a lot of the time. You're going to have to put in the effort, even if you feel tired, going to the gym or going for walks, even if you have an increased appetite, making more appropriate food choices? Are you willing to put in the work? Speak to your doctor about it, right? If you're really willing to address this, speak to your doctor and see if there are any other options. And if you need support with this, get professional support. Do you need to speak to a psychologist? If you are binge eating, get specific help in binge eating. If it's nutrition education, actually see a dietitian or a nutritionist. They're my tips if you're struggling with this. And just remember, weight gain is not the end of the world, but the way you think about it can make you think that it is. Let me know if you enjoyed this episode. Don't forget to leave a rating or a review. Thank you so much for all your positive feedback on Instagram. I appreciate it so greatly. Enjoy your weekend. Have the best time, and I'll see you in the next episode. Bye.